So, a little history of Tai Chi. According to some reports, Tai Chi dates back to the 13th century in China. It's been practiced in the United States since the first Chinese immigration. It was popularized in the 1960s when acupuncture and Chinese medicine came into the mainstream in the United States. Dr. Fuzhong Li brought his version, Tai Chi Moving for Better Balance, into the 21st century by studying Tai Chi's effects extensively in a clinic setting, creating an evidence-based practice for fall prevention at the Oregon Research Institute. I will remain standing, having the back of a chair ready to support my stability. Cassandra is seated to demonstrate the seated position. And the seated position is valid in Tai Chi and may even be more beneficial to correct posture and offer more exercise potential. Let's start with a little bit of warm-up exercise. So I'm going to start with my feet shoulder width, as will Cassandra in the chair. And I'm going to sink the weight into my feet. What I mean by that is bending the knees slightly from the standing position and just feel the weight of the body go into the feet. Cassandra will feel the weight of her body go into the sit bones on the chair and into the feet. In the chair, she will want to sit slightly forward. So again, not with her back against the back of the chair, but about halfway along the chair. Feel your stability, not too far forward yet, because you don't want to tip, but feel your stability in the chair. And that you're not using the back of the chair as a prop. Our feet are shoulder width. We sink the weight. So again, bending the knees slightly, feeling the weight in your feet, in the chair, also in the sit bones. We're going to start doing a little counter swing. So counter swing is pushing through your right foot and looking slightly left, pushing through the left, looking slightly right. And you can see Cassandra's posture in the chair. She has a nice upright spine. She's not moving her head and neck. She's actually moving the body. So you can see that if this is my midline, if this is my belt buckle right here, let's get it in the middle. This is my belt buckle. My chin is not moving past my belt buckle. I'm turning at my waist, looking from side to side, just slightly out of the corner of my eye, breathing in the belly. Your tongue is lightly touching the roof of the mouth. And you can see Cassandra's posture as ear over the shoulder, over the hip, over the ankle. I also am doing this from the standing position. So you can see I have a little weight shift going on. I'm just a gentle turning from side to side using the waist. Breathing. We're going to work on the breath in just a minute. Tongue is lightly touching the roof of the mouth. So even by just doing this gentle weight shift, a gentle looking from side to side, we are getting blood circulation going from the feet, from the calves, back up into the heart to oxygenate. We are engaging the glutes, we're engaging the abdominals, we're letting the shoulders and your neck relax. Normally, those are the muscles, the trapezius, that we use and overuse, yeah? So now we're using the base of the body to move the whole body. Tai Chi is a whole body exercise. And you can just shift slightly more by bending the knee a little bit more from the standing, Again, in the chair, you want to make sure that you don't hurt your hands, but you can let the hands swing a little bit. In the standing posture, you can let them hit the body. That's going to be waking up acupuncture channels, waking up circulation. Again, looking from side to side, relaxing the shoulders and the neck, breathing. You're going to breathe in through the nose. You can exhale through either the nose or the mouth. Breathing in the belly. Make it gentle, make it slow. It's much more difficult to perform tasks slowly, as it is for me to speak slowly, than it is to be quick, yeah? The fast twitch muscles like to take over. Let's exercise the stability, tendons, and ligaments. Those are what keep us upright. And you can go just slightly faster. Have the chair at the ready in case you feel any instability. Shoulders relax, breathe, enjoy. When you're looking from side to side, see what you're looking at. Many times we're walking along with the grocery list, the to-do list, the honey-do list on our mind. We're not seeing where we're going. Moving your eyes keeps the flexibility of the eyes. Seeing what you're looking at will keep you aware of your surroundings. Again, another fall prevention issue. We're not looking where we're going, yeah? Okay, and slow it down slightly. And shake it out a little bit. All right, so I shake it out in between postures of the form, in between warm-ups, just to get the circulation to be circulating, right? So we're going to do a little breathing now. I'm going to stand sideways so that you can see I'm still in my shoulder width position. I'm going to sink the weight. Again, it's just a little bit of a sit, almost like you're just about ready to sit on a tall stool, but you haven't put this part out yet, yeah? So we're just going to sit slightly, let the shoulders relax. We have that orientation, ear over the shoulder, over the hip, over the ankle. And I'd like you to place your hands on your lower abdomen. So it's a little below your belt buckle here, just a little below, just place the hands there. And the breathing we're going to do is abdominal breathing. So as we breathe into the belly, you feel the belly expand. Then slightly into the middle, slightly into the top of the lung. And then we're going to breathe out the top, out the middle, and out the belly. So again, sinking the weight, breathing in the belly. So you see the belly expand, middle and top, and out the top, middle, and belly. Breathe in through the nose, belly, middle, and top, and out the top, middle, and belly. And breathe out through either the nose or the mouth. Breathing in, and exhaling out. It's almost like taking a pitcher of water, breathing in, and you pour the water into the glass. It fills the bottom of the glass, like the bottom of your lung, and then the middle, and then the top. And then as you pour the glass of water back into the pitcher, it's going out the top, middle, and out the bottom. So breathing in the belly, middle, and top, and out the top, middle, and belly. Many times we breathe just in the chest, and you feel the rib cage expand, but nothing's happening in your belly. Keep breathing. But what we want to do is breathe into the belly. There's an air exchange. Otherwise, you have stagnant air at the base of the lung. And that high chest breathing is what happens in fight or flight. So it almost creates a sensation of anxiety. So for a nice deep breath, we breathe in the belly. You're doing this in your own time. Middle and top, and out the top, middle and belly. A few more breaths. Try to keep that soft knee. If you're standing, feel your feet on the floor. If you're seated, feel your sit bones in the chair. Belly, middle, top, out the top, middle, and belly. I'm already feeling more relaxed. Not my strong suit to be in front of a camera, but this is helping. Okay, and just let the arms come down and shake it out a little bit. Get that circulation going in the hands and feet, moving through the body. All right. Well, we're going to have a little more information. You can continue doing that breath if you like. You can continue doing a little counter swing. You just a slight movement, yeah, while I speak. So many people ask me in classes, do I lose weight with Tai Chi? How many calories do we burn? I don't know how many calories we burn. However, I found a study, a 3-group randomized controlled study published in the Annals of Internal Medicine. And that's regarding abdominal obesity, which is a major manifestation of metabolic syndrome. And that is something that's a common problem for adults 50 and older. Tai Chi was tested along with conventional exercise, which was aerobics and strength training. And of course, there was a control group that did nothing. And they were assessed at week 12 and week 38. Waist circumference, okay? Waist circumference reduction in the Tai Chi group versus the conventional, the strength training and aerobics. The Tai Chi group showed slightly better, 1.8 centimeter reduction versus 1.3 centimeters for the conventional exercise. Both showed favorable weight loss and lowered HD, the bad stuff, cholesterol. But only the Tai Chi group maintained the benefits of lowered blood cholesterol and improved cardiovascular health. And it was not by week 38. And there was not a significant improvement or continued improvement in the conventional exercise group. So let's do the beginning posture of the form. So in the form, and in most forms of Tai Chi that I know of, what about you, Cassandra?
Yes, almost all forms of Tai Chi will begin with what we call the opening or commencement.
Or the beginning. So I'm going to teach you the beginning form. Can be done in the chair, can be done with the chair to stabilize you from the standing posture. We're in our shoulder width stance. We're going to sink the weight. Feel the weight of the body in the feet. Breathing in the belly. Now we know how to breathe. Bringing the breath way down into the abdomen. Let's just stay there for a minute. We have the slightly bent knee. In the chair, you have the weight, feeling the weight in the feet and in the sit bones. You're breathing in the belly. Your ear is over your shoulder over your hip, over your ankle. And we're going to start with the beginning posture. So in this posture, you're going to draw the arms up, breathing in the belly, middle, and top of the lung, and draw the hands back down, breathing out the top, middle, and belly. You're going to draw the arms up. Feel like there is resistance against the back of your hands. And draw the hands back down. Feel like the palms of your hands here are pushing against a column of air. Draw the arms up. And this sounds a little esoteric, but it's actually a strength training exercise, because if you feel resistance, your muscles will engage. Draw the arms up and bring the hands back down. So your elbows are heavy. You see both Cassandra's and my elbow comes down first. The elbows draw the arms down. Again, you're feeling that resistance. You're pushing through the ground with your feet to move your hands and arms, and bring the hands back down. Press that column of air against the floor. Draw the arms up. Let's investigate a little bit by pushing into the ground with the feet, pushing into the ground with the sit bones and the feet from the chair. And draw the arms up. Yes, you can see Cassandra has the perfect posture. This is something that will help your postural stability throughout everyday life. Going to the grocery store, taking that turkey out of the oven and Thanksgiving. This is going to help keep that upward, downward of your spine. Breathe in through the nose. Exhale through either the nose or the mouth. Inhaling through the nose. Exhale through either the nose or the mouth. This is a lovely exercise to do on its own, because when you do it, you feel as though you calm down. And engaging the whole body in this movement gives your neck and shoulders a vacation. So pushing through the ground with the feet lifts the arms. Not much arm and shoulder muscular activity. Draw the arms up and bring the hands back down. One more. Feel the breath. And exhale down. All right, shake it out a little bit. Now I'll ask Cassandra to teach us the first posture of the form.
As we sit in the chair away from the back, and as you stand, perhaps with one hand on the back of a surface for support, we're going to use our breath to move the weight of the body to your right. So I'm breathing into the left side to move to the right. I'm mirroring you. And let's check in the chat box. I saw a little something there. We want to make sure that we're doing A-okay. Okay, I think we're good. Okay, so make sure.
Could we minimize the chat box? Thank you. There's no other messages up in the top?
I think we're good.
We're good. All right.
So, using the breath to move the body. So I'm breathing into the left to move to the right, and that creates motion.
And again, as Cassandra said, when we move to the mirror means that you do the side that we're doing, even though it doesn't, we're facing you.
Here we go. As you notice, when we do that, the arms want to move. So we're going to allow them. I'm breathing into the rib cage. My elbows stay low. The right arm comes up and over and rests about the height of my collarbone. The lower palm turns palm up. This is called a hold the ball position. Do this again. Here we go. Breathe. Holding our ball. And we will do this not only on the right side, but also on the left side. Now breathe into your right rib cage. Let your ribs move over, elbows stay low. As the hands follow the motion, now the left hand is on top, thumb about collarbone height. And returning to the right. So the postures are what happen in between the hold the ball for this particular form. This is going to be a sideways motion, and the posture we're going to do is also a sideways motion. Now in Tai Chi, we start from the ground up. I'm going to look out of the corner of my eye to your left, take my mind into the left leg, using the left ankle, raise the left heel, use the ankle to pick up the left toe, now my foot's hovering. Use my left hip socket to move the left leg over a tiny bit. Use the ankle to put the toe down. Use the ankle to put the heel down. This is the first step. We want you in your daily life to position your feet first. Now we're going to use the belly that we warmed up to reposition the hands. I will breathe, and on the exhale, my top hand follows, and I will inhale, and the low hand comes up in front of the chest, but on the right side. This position is the position for ward off. Now we breathe into the right rib cage to move to the left. And that is the movement ward off. I rotate my hands, and we have returned to left hold the ball. I take my mind and put it into the right leg. Breathe as I raise the right heel. Breathe as I use the right ankle to lift the right toe. Now my foot's hovering. Breathe as I use the right hip socket to move the toe over, hip distance from the left, toe down. Breathe, heel down. Now, the great thing about the moving for better balance form is that the postures are done on both sides. So now we'll do the other side, going to your right. Looking out of the corner of the right eye. Breathe, raising the right heel. Breathe, use the ankle to lift the right toe. Breathe, use the hip to move the right foot over, toe down, heel down. Moving back to the belly. Breathe, lower the top hand. Breathe, raise the low hand. Breathe into the left side to move to the right. The movement ward off. Rotate both hands, right hand on top. We're in right hold the ball. Breathe. Use the left ankle, lift the heel, lift the toe, use the left hip socket to move the left in towards the right, toe down, heel down. and relax. And that is one sequence in the form. But notice the progression. First the feet. Use the belly to position the arms. And the last thing we think about is using the breath to cause movement. So let's try that. Hold off. Breathe. Look to the left. Step out with the left. Toe down. Heel down. Breathe. Use the belly to lower and raise the hand. Breathe. Use the belly to move to the left and rotate the hands into left hold the ball. Breathe and move the right towards the left. Other side. Ward off. Look. Step. Heel down. Lower. Lift. And breathe to move. Hold the ball. And bring in the left toe heel. And one more time. More on your own. Other side, returning to the right. And the left foot steps in, toe, heel. Very good. Great job.
All right. All right. So looking again at our study, I have another study from listed in ABC Science, which is from Australia. Tai Chi boosts immunity. So this was a study done by Dr. Michael Irwin of UCLA. Controlled study in the United States of both men and women, average age of 70, show that those who used Tai Chi's combined elements of movement and meditation over several months enjoyed a 50% increase in immune cells. This was a study done on people who had had a vaccine against the shingles virus. So Tai Chi combined elements of movement and meditation over several months, and again, enjoyed a 50% increase in immune cells. A week after the end of the study period, with physical checkups and immune system tests showed that on an average, the Tai Chi group did not simply feel healthier, but had sharply increased levels of memory T cells that specifically recognize and attack the varicella virus, which is the shingles virus, although individual responses varied. Tai Chi involves making slow and precise movements coordinated with controlled breathing. Subjects in the Tai Chi group also showed improvements in physical functioning, especially those who before the study had problems with common tasks such as walking and climbing stairs. So again, it's another study out of UCLA. So let's learn another posture of the form. We'll do the second posture, which is parting the wild horse's mane. So for this, we'll start with our feet together and breathe into your belly. Tongue lightly touches the roof of the mouth. Sink the weight. Remember, feel the weight of your body go to the feet and sit bones in the chair. Stepping out with your left foot, shoulder width. So I have my chair here if I need my stability, and sink the weight. So feel the weight of the body go into the feet. We're going to do the beginning posture to start this off. So that was what we did at the beginning of the session. Beginning posture. Draw the arms up, breathing in the belly, middle and top of the lung, and draw the hands back down, breathing out the top, middle, and belly. You're going to sink your weight into the right. As Cassandra said, feel the rib cage come over, breathe into the belly. Sink your weight into the right leg and hold the ball. Your right hand will be on top. Elbows are heavy, so they point to the floor. Actually, both elbows do. Instead of keeping this one up, you want both elbows pointing to the floor. And we're going to start parting the wild horse's mane. So you're going to step to the forward diagonal. If you're facing the front of the room, that's going to be the forward corner of your room with your heel. So take a nice gentle step, not too far. We don't want to lose our ear over the shoulder, right? Orientation. So it's just swing the leg out slightly in the hip joint. Knees are both bent. Yeah. Now we're going to push from the back foot and swing that bottom hand out as you push down the top hand. Now I want to show you that this isn't an arm and hand movement, yeah? So if we come back here into our beginning posture, into our beginning stance, we're holding the ball. We're going to step to the forward corner with our heel in the chair as well. And you're going to push from the back foot, but you see, as I push down with the top hand and swing out the bottom hand, my whole body will turn. So in Tai Chi, you want that hand and heart connection. So if my hand is out here, it's not out here, yeah? But it is out to where if I just bend my elbow, I can touch the area of my heart. That is a protection for your vital organs because they're all here, right? Mostly through here. So you want the hand in a proper position. All right, so then you're going to sink your weight back into your right foot. Pivot your left toe forward on the heel. You see how that works? Have your heel on the floor and you just pivot it slightly to face the front of the room. Shift your weight into the left foot. Hold the ball on the left. Your left hand will be on top. That's your stable position. Step up with the right. Okay, get to where you're feeling stable here again. And now you're going to step into parting the wild horse's mane right. So feel the weight in your left foot. Step to the forward diagonal with your right heel. Pushing from the back foot. You see the ball of the foot is still up, yeah? Pushing from the back foot, you're going to shift your weight forward till the toe touches, push down the bottom hand, swing out, or the top hand rather becomes the bottom, and swing out that bottom hand. So again, it is a movement from my waist, like this, yeah? So I'm not swinging out the arm on its own. It comes from moving my body. We're going to shift our weight back into your left foot, pivot that right toe forward. It's on the heel. You're going to pivot the toe forward, shift your weight into the right, hold the ball on the right, step up with the left. Okay, I'm going to step back a little so you can see where my feet are going. I still have my chair for stability. I'm going to do that again. I'm going to step to the forward diagonal corner. You're holding the ball on the right. You're going to step to the forward diagonal with your left heel. Your toe is still up. Push from the back foot. Relax your shoulders here. Calm down. Yeah, bend the knees slightly. Push from the back foot. Top hand pushes down as you swing out at the waist and turn the body to move the bottom hand. Relax your shoulders here. Shift back, Pivot that front toe forward. So you're just on the heel. Move the toe to face the front of the room. Shift your weight into the left. Hold the ball on the left. This is your stability position. Step up with the right. Parting the wild horse's mane right. As Cassandra told us, we're looking right first. We look where we're going. And we step to the forward corner with the right heel. Pushing from the back foot. Shift the weight. As you push down the top hand, swing out the bottom hand. Turn the waist just to the forward corner. Shift back. Pivot the front toe forward. Hold the ball. Step up with your left. Shake that out for a minute. We're going to do it one more time, but I'd like to explain a little bit. When I'm asking you to turn at the waist, your waist is up here. Waist is muscle. You can feel that. Hips are bone. If you're turning your hips but not moving your feet, then you can really do damage to your knees. Yeah, if you're doing this at the hips, right? So here's the bone, and this is your waist is muscle. So you want to be able to turn at the waist. All pretty much that I can think of, all sports turn at the waist. Golf, hockey, baseball, football, when you're throwing a pass, they're throwing from the waist. They're not turning their hips over here, right? Because then they would have no knees after like a year. So turning at the waist, you've probably done this in sports many years, even back into soccer, I bet, right? Because the hips stay forward, but you turn the waist. Okay? All right, so let's do a couple more parting the wild horse's mane. We're going to sink the weight and hold the ball on the right. We're going to step to the forward corner with our heel. Again, that's going to be your left heel. And pushing from the back foot, shift the weight, turn the waist. So just when the toe touches, that's where you shift the weight to. So right now I'm probably 60% on my front leg and 40% of my weight on my back leg. Now I'm going to shift the weight back into the right. Pivot the left toe forward. Shift your weight forward into the left. Hold the ball on the left. Step up with the right. Parting the wild horse's mane right. Do that little look right. Yeah, with the corner of your eye. Let's keep the eye flexibility. Step to the forward corner with your heel. Pushing down that top hand, swing out the bottom hand, turning the waist, not swinging the arm. Shift back, pivot the front toe forward, hold the ball, step up. And now we're going to learn that at the end of the form, we will hold the ball to our chest to center. So for you, left hand is on the inside, right on the outside, and close. Stepping in with your left foot. And shake that out a little bit. So, you have information you want to give? I'm going to get the water here.
Right. Yes, feel free to get a little something to drink, refresh yourself while I provide more information. There was an integrative review of 20 years of research done through and published in the Geriatric Physical Therapy Journal. And they found that over 20 years' time, looking at all of the research done for balance and mobility in older adults, that balance and mobility have definitely been improved by Tai Chi. Also, they realized that practitioners in the clinic, such as your doctor or your physical therapist, or even your acupuncturist, have embraced Tai Chi as an appropriate exercise for older adults. Also published in the Journal of Geriatric Physical Therapy, balance and functional outcomes for older adults who practice Tai Chi versus those who do not, Tai Chi participants improved in nearly all measures, whereas those who were not participating in Tai Chi did not. There was a significant improvement in this timed up and go test, as the ability to stand up and walk, and also significant knee extension strength improvement in the Tai Chi group versus the group that did not participate in Tai Chi. They also noted confidence in performing functional tasks. Now, Ruth had mentioned the ability to walk upstairs. Well, there's also shown that the ability to walk downstairs safely was also much better for Tai Chi practitioners. There's better postural control, increased ability to keep the eyes focused as opposed to going head down, and also better foot clearance going downstairs. Most falls happen, unfortunately, going downstairs. And they also showed that people who did Tai Chi were able to dual task. That means that they could walk downstairs and talk safely or perform another activity at the same time and still remain safe. Pretty good for a slow movement exercise.
So we've seen many benefits to Tai Chi, and let's do a mini form. So we're going to take all the pieces that we've just learned and put them together and flow them. We'll talk you through them, but let's see how they go together. So we have our chair for stability. Cassandra's in the chair. And again, she's not right back in the chair. She's a bit forward in the chair. And we're going to start with our feet together. Breathe into the belly, tongue lightly touching the roof of the mouth. Sink the weight, so feel the weight of the body go into the feet. Stepping out with your left foot. Again, pick up the heel. You still have the ball of the foot on the floor for balance, and step out shoulder width. Let the heel come down. This is a good time. In Tai Chi, we don't normally look at our feet. Our feet take care of themselves. But when you do the step out, you might want to take a quick peek down at the feet. You want the toes across from the toes, ankles across from the ankles. Sink the weight. Feel the weight of the body go into the feet. And in the chair, you'll feel the weight go into the feet and the sit bones. Breathing in the belly, tongue lightly touches the roof of the mouth. Calm down. Beginning. Draw the arms up and draw the hands back down. Sink your weight into the right and hold the ball. First posture that Cassandra taught us was hold the ball, ward off. So we're going to step out to the side with the ball of the foot. And you're going to roll that ball. So you're going to press down the top hand, pull up the bottom hand until the hand, the top, what is now the top hand is across from your heart. Turn the waist, that lowers your heel, just to the forward corner. Remember, elbows are heavy, so they point downward. They're not up here. Let them relax. Shift your weight into the left. Hold the ball on the left. Step in with the right. Ward off, hold the ball right. You do a little look to the right. Inhale in the belly, move your rib cage slightly right. And pick up the heel Ball of the foot still on the floor for stability. And then step out to the right with the ball of the foot. Roll the ball. So push down the top hand, pull up the bottom, hand and heart connection. Turn the waist, look over that top hand now. That's where your vision should be. See what you're looking at. Shift your weight into the right. Hold the ball on the right. Step in with the left. And we'll do parting the wild horse's mane. You're going to step to the forward diagonal corner. So if you're facing the front of the room, you're going to step to that left forward corner with your heel. Again, bend the knees. Just sit. Push from the back foot, pushing down the top hand, swinging out the bottom hand. Shift back. Pivot that front toe forward. Shift your weight into the left. Hold the ball on the left. Left hand is on top. Step up with your right foot. Adjust your feet if you need to. If they were a little bit one way or another, just adjust them, make them comfortable. Parting the wild horse's mane right. Look right. Do that little look. Again, inhale in the belly, move the rib cage slightly, step to the forward corner with your heel. Pushing down with the top hand, swing out the bottom hand, just to the forward corner. Don't go too far. Relax your shoulders here. Let the shoulder blades just roll down the back. Breathe. Shift back. Pivot that front toe forward. Hold the ball on your right. Step up with the left. Let's do it one more time. We're just going to do ward off and parting the wild horse's mane. So ward off, hold the ball left. Look left, step out to the side with the ball of the foot, roll the ball, turn the waist, just to the forward corner. Shift your weight into the left by just pushing through that right foot. Hold the ball on your left hand on top, step in. Ward off, hold the ball right. Do that little look right, move the rib cage, inhale in the belly, step out to the side with the ball of the foot. Roll the ball, push down the top hand, pull up the bottom, turn the waist, just to the forward corner. Again, hand and heart connection. Have that hand in front of your heart. Now pick up the heel to shift your weight into the right, hold the ball on the right, step in with the left. That was a sideways step, yeah? Now we're going to do parting the wild horse's mane. So I'll step back a few steps so you can see my feet. Parting the wild horse's mane left. Look left, step to the forward corner with your heel. Again, bend those knees, pushing from the back foot, shift your weight, turn your waist. Just to the forward corner, pushing down the top hand, swinging out the bottom. It's like throwing a Frisbee, right? Yeah? Okay, shift back. Then you also turn your waist, yeah? Not just your arms. Pivot that front toe forward. Shift your weight into the left. Hold the ball on the left. That's your stability position. Step up with the right. Parting the wild horse's mane right. Look right, step to the forward corner with your heel, pushing from the back foot, push down the top hand, swing out the bottom, throw that Frisbee. Shift back, pivot your front toe forward, hold the ball on the right, step up, hold the ball to your chest to center. So again, it's like you have a big ball in the center, and close, stepping in with your left foot and shake it out a little bit. Right, so again, some of the main things that we want to think about is breathing in the belly, middle and top of the lung, and out the top, middle, and belly. You don't have to force it. It's like a river. Just let it come down. If you feel resistance, just let it go. Start again. Just put your hands on your belly. Inhale in the belly. Let's do just a couple breaths to finish here, yeah? So put your hands on your low belly. Inhale in the belly, middle, top, and out the top, middle, and belly. Inhale in the belly, middle, and top, and out the top, middle, and belly. Keep going in your own time. Remember, Tai Chi is a movement and meditation exercise. Breathing in your own time. Tongue lightly touches the roof of the mouth. So when you're doing Tai Chi, you can just calm down. Breathing in the belly, middle, top, and out the top, middle, and belly. All right, shake it out a little. And let's check the chat box for questions.